Hi everybody, welcome back to the channel. It is Askawayhealth, where we love to provide you with direction and clarity about everything medical. So today I'm starting a new series on fertility. You guys know I love doing series, but fertility is such an important topic and you just can't cover it in one video. This is a short one and I'm looking at the effects of age on fertility. So over the next few weeks and months, we'll be looking at different aspects of fertility. So if this is a subject that you want to learn a lot more about, feel free to send me a message, tell me which particular area that you'd like to cover, and we might be able to do a video on that, and I'm looking forward to hearing from you. Effects on age on fertility. And before you think I'm going down the route of blaming women or saying this is a women problem, no, I'm going to be looking at both women and men in this video. Let's get into it. Growing older can affect fertility, and this is whether you're male or female. Is it possible to do some things to reduce the impact on age? Possibly. Let's have a look at some pointers in this video. It's true that many couples are choosing to have children later these days for several reasons. It's true that this may work out for some, can still manage to have the number of children that they hope to have, but in some other couples it is difficult to have kids as they grow older, and of course this carries with it a significant amount of anxiety. So let's look at what some studies say about getting pregnant. It is thought that up to 84% of couples will get pregnant in the first year, or within the first year of trying to have a baby, and this 84% includes couples of all ages without any restrictions. So people who within their first year in the relationship are having regular unprotected sexual intercourse 2 to 3 times a week, 84% of them are likely to fall pregnant. This percentage increases to 92% in the second year and 93% in the third year. So this is of all couples across the board, whatever age, trying to get pregnant within the first year of the relationship, having regular unprotected sexual intercourse. For women, we know that as they grow older, fertility reduces, and we know this has to do with the reduction in the production of estrogen and therefore ovulation as a woman approaches menopause. But this ticking clock thing also applies to men, because even though men do not have a natural menopause the way we identify women as having, there are some particular factors that can affect a man's fertility as he grows older. So let's look at some of them now. More studies have shown that the amount of semen a man produces peaks, is highest between the ages of 30 and 35, after which it begins to reduce. So if the quantity of semen is reduced, you can extrapolate that the amount of sperm within seminal fluid begins to reduce as a man grows older. So from the ages of 40 upwards, you're looking at a reduced amount of semen production and therefore a reduced amount of sperm within the man's semen. The second factor that we're going to look at for men is that the motility of the sperm, that is, the ability of the sperm to swim, which is crucial for fertilization and pregnancy, actually begins to decline in men after the age of 55. It is demonstrated to be highest before the age of 25. The third factor is that genetic defects increase in the sperm of men as they grow older. So that means genetic problems within a man's sperm are more likely to happen as the man grows older. So this can lead to problems with infertility or subfertility, or increase the risk of miscarriage or having children who have birth defects. In addition to this, it's also been found that the older age of the father is associated with genetic problems in the child, in their offspring. Some of the conditions that are associated with this include Down syndrome, childhood leukemia, autism, schizophrenia, bipolar disorder. These are a few examples. Last one I want to look at today is that sexual abstinence, which tends to occur in men as they grow older for one reason or the other, is associated with a reduction in the quality of the sperm that's produced. So you find that frequent sexual activity is associated with healthier sperm being produced. These are some of the factors that can affect women and men as they look to get pregnant, or as couples trying to get pregnant, it's important to bear in mind a few things that you can do to help get things going, in addition to maintaining a healthy diet, healthy lifestyle, exercising, not smoking, making sure that you avoid risk of developing sexual infections that can affect fertility in the future. Like I said, it's just a brief video. We're starting off this series. We've been looking at the effect of age on fertility, not just at the woman and menopause, but factors that could affect the men. If you've got any questions for me on this topic, feel free to send a message. I'll put the details for our contacts in the description. I'm happy that you spent some time with me today. Thank you for listening. As always, it's Askawayhealth, where we love to provide you with direction and clarity on everything medical. I'll see you again soon.